Hi, I'm Dr. Kelly Starrett from the Ready State. Oftentimes when we undergo a surgical procedure, one of the things that happens is that we find ourselves in a situation where our appetites are a little bit changed, and the environment in which we normally were eating is also highly altered. Oftentimes people report they've got decreased appetite, or in my case, when I had knee surgery, I was highly motivated to eat a lot of cinnamon rolls and ice cream as a self-soothing mechanism. So one of the things that we know that we can absolutely control in terms of speeding up or enhancing our natural healing ability, or at least maximizing it, is actually focusing on a single micronutrient, and that's protein. Of course you want to drink water, of course we want fruits and vegetables in there, but one of the things that we find is that after surgical interventions, most of the time people's protein intake tends to drop a little bit. They're not really hungry for chicken and steak and eggs, and oftentimes those things are hard to cook and they just don't feel really good. They're not highly palatable in that moment. But one of the problems is that during this time we actually have increased protein needs. And it's not just about musculature, although that's important. It's also just about taking the view that if I'm not getting enough protein in, I'm not going to have an adequate supply to maximize my connective tissue healing and all the soft tissue healing that's happening sort of post surgical intervention. So our recommendations are pretty simple. From the International Federation of Amateur Athletics all the way to sort of the best recommendations of sports performance coming out of cutting-edge, high-performance environments, is that we'd like people to get at the minimum 0.8 or 1 gram of protein per pound body weight every day. And now, for most of us, that's actually going to be a little bit of a big ask anyway. But one of the things that we've found out is that if we can up the protein, a couple things happen. One is that we tend to be a lot fuller. And that fullness means that I tend not to want to eat Cheez-Its and bowls of cereal because I'm actually just have a high satiety level. I feel very satiated. The second thing is that we're trying to do is actually keep people's lean muscle mass on them. And when I go from periods of high activity to periods of inactivity where I'm laying around or convalescing, oftentimes what happens is our bodies want to kick out those protein structures because they're hard to maintain. And what the research supports is that if I can up my protein intake, I can often do a much better job at keeping that muscle mass even during times of sort of inactivity. And so for some of our populations who are athletic based, that can make a real difference in terms of them in a better position to return to sport. And for some of our populations who don't have a lot of extra lean muscle mass to give away, keeping that muscle mass on can be a matter of durability and longevity in the long haul. So again, the idea here is, hey, let's simplify it. If you need to supplement with a protein source like a protein powder or bar, that's totally okay. But see if you can't get 0.8 to at least 1 gram of protein per pound body weight during the 6 weeks around your surgery.